Thanks for joining us today for BRMC's Healthy Connections. Nancy Svella is our guest, and Nancy is going to be talking to us about kind of everything you ever wanted to know about Medicare and were afraid to ask or just read and didn't understand. So tell us about Parts A, B, and C, Nancy.
Okay. Well, I just thought we'd start with an overview because a lot of people don't understand, you know, what that little card means. So, and maybe haven't even heard of Part C. So, Part A on your Medicare card is actually your hospital insurance.
Okay.
And it pays for inpatient hospital care, if you need to go to a skilled nursing facility, maybe for some rehab. It also pays for home health and then hospice care. And then that Part B on your Medicare card, that's your medical insurance. And that covers your doctor's services, it covers medical equipment, although they don't cover much bathrooms. They don't cover bathroom stuff.
No.
Except like a bedside commode, usually.
Okay, maybe a bedside commode.
Yeah.
How about walkers?
They do walkers, but they don't do shower benches, which is kind of silly because that's where most accidents.
Sure, exactly.
So, but it also helps to cover like your x-rays, labs, outpatient stuff. And then for a lot of people, there's a Medicare Part C, and that's more of an Advantage plan. And that's could be an all-inclusive type plan depending on what plan you have. The thing I always like to tell people that when they get into an Advantage plan, they no longer have Medicare. They switch from a Medicare to an Advantage plan, and a lot of people don't understand that.
No.
They'll think they have both Medicare and Advantage plan at that time.
So it's one or the other.
Right.
You don't get both.
Right.
Okay.
So
Which
just
sense.
to know that.
Yeah.
And then those can vary greatly. Some of them will include prescription costs and just so it's always good to look at those close. And then your Part D on your Medicare is your prescription drug plan.
Okay.
So you actually have to have like Part A, Part B, and a Part D. When you're on Medicare. So, and that's usually run by private companies. We have a big variety of them, and of course right now is the open enrollment time for the Medicare Part D, and I think that goes through December 7th. So.
And they only do that once a year?
They do. It's,
okay.
I think it's October 5th. They switched it. It used to be November, but now it's October 15th through December 7th.
Okay.
And you can go in at that time and change your drug plan if you want, or make any switches.
Can you make any
You
chair?
can actually switch from Medicare to an Advantage plan at that time, or Advantage plan back to Medicare. So
is the Advantage plan in most cases, because as you said, it's contracted out to different various healthcare providers,
right,
or insurance companies. Is there a difference in cost, a huge difference in cost?
Well, for some people it's cheaper. And because when you have Medicare Part A and B, you usually need a supplemental insurance to cover what is not covered under the Medicare. Where an Advantage plan, you don't have to have a supplemental insurance, and you shouldn't have a supplemental insurance. It should be an all-inclusive. It should tell you, you just have a $25 copay at the doctor. If you go in the hospital, this is how much you're going to be expected to pay, and those kind of things. And then some of them cover medications too.
Okay.
So. Yeah, so there's a lot of differences there.
So when people are thinking about switching, what would you recommend? Where should they go to get more informed, better education?
I would say at the Mruk Family Center on Aging, we work a lot with that, with the different plans. I mean, just the information. And we do it non-biased. We don't, make any recommendations. For prescription drug plans, Area Agency on Aging, they help people do that. Of course, there's a lot of agencies in town that will work with you on those kind of things. I do think they probably get a small fee for that.
And Mruk Family, oh, there goes my voice. The Mruk Family Center on Aging doesn't charge anything for this service. It's all free.
Yeah. We're just trying to educate people about what's out there, how the system works, and so that they're informed when they go look at it, at the different plans. So
they can be well informed and make a good decision based on all the information that they've gotten over at the Mruk House.
Oh, definitely. Yeah. And I've seen times before where a lady had come to me, she had gotten in the plan and didn't even realize she had lost her Medicare and was still paying for a supplemental and was in an Advantage plan, which you're not supposed to even have a supplemental insurance. So she was like paying double. So,
wow.
But so we were able to help her get out of that. But But you know, it just depends on each person's situation, their medical needs, and they just need to really look at the plans and read the fine print and, you know, see what's covered as far as inpatient and outpatient.
Right.
So.
Right. Because, for instance, would somebody really want to go ahead and get Part D for prescriptions if they really weren't taking many prescriptions? And it's kind of a,
well,
I hate to say a crapshoot, but
it kind of is, and I see that a lot. The only thing wrong with that is if you don't get on Part D right away when you get eligible for Medicare, when you do get on Part D, you get penalized, and that penalty stays with you the rest of your life.
Oh my goodness!
So if you wait a year,
yeah.
you may have to pay an extra $14 a month for the rest of your life.
Oh wow!
So,
and see that? Yeah, that's why people need to come in.
They do
and sit down with you and find out.
Yeah, and
all
find
the ins
out
and
the
outs.
ins and outs. So
yeah.
I usually recommend, you know, even if they're on no medicines. I mean, we see a lot of really healthy people in their 80s and 90s, and I, you know, I say I would take out the cheapest one, you know, instead of in a year say, you know, our health's going to change as we get older. Instead of getting stuck with that penalty, and it can get pretty hefty after if you've gone a year or two. So
yeah, wow,
and that just continues then. So, but one of the things we do with the Medicare, a couple of programs that we're working with the SHIP department out of Little Rock is the Medicare Savings Plan, and then the Extra Help program.
Okay, talk to us about those.
Okay, all right. I got to get my little reference sheet here. There's a lot of guidelines for it, but depending on the income level, what the Medicare Savings Program does is it will pay for that Part B, which is your medical. Now, most people pay $94.60, but I think it's gone up to $110 a month. So if you're on a limited income, say you're only drawing $500 a month,
it's a huge difference.
It is. If we can apply for this program and get that $100 back to you a month, you know, that helps to buy those food and groceries and different things you might need. And so, and so that's part of the Medicare Savings Program. And I'm just going to peek at the guidelines for that. The highest income you can have for that program is, for an individual person, is $1,245 a month.
Okay.
And then for a couple, they can't draw more than $1,674 a month. Those are this year's guidelines.
Okay. Now, sometime in the past, I know we've talked about assets. Can you explain? I think sometimes people get real confused, and I'll be right there in with the confused bunch. You can still have assets, however.
You can.
Okay.
For a couple, the assets, and this is like CDs, money, bank accounts, savings accounts. If you had like a whole life life insurance policy that you could cash in and say it was worth $5,000, that would be an asset. But assets are mainly our extra money you have saved up, or the CDs. It doesn't count your house or your car.
Okay, and I think people always want to put that in that as, oh, I've got a huge asset, my home.
Right.
You know, and
for this program, it doesn't count. Now, say if you own 2 homes, then yes, one of them would.
Yeah. And
you probably wouldn't qualify. The asset guideline is for a couple, and this is just for the Medicare Savings Program, is not more than $10,000 for a couple, and then for a single person, it's $6,600.
Okay.
So, and like I said, it doesn't count your car or your home that you live in.
Okay.
So, and that gets kind of confusing.
And this is, once again, people can come into the Mruk Family Center on Aging and for no charge.
Yeah, this is a program we do free of charge.
Okay.
In fact, we're trying to get the word out there, because in between Mountain Home and Marion County, there's over 1,000 people that qualify, and they don't even realize that they qualify for this. And so we just do it as a courtesy to try and help people. And and they can call us and make an appointment. We can even do it over the phone now. We went through some more training, and now they've said we can. You know, a lot of people live rural, and they can't get out of their home or can't get a ride in, so we can help them just by phone do this.
Oh, and that's excellent, especially right now. Our weather's gorgeous, and it's winter time, but we don't know if that'll last or not.
That is true. So that's just a really good program that we work with the SHIP department on. And then we have the Extra Help program.
Okay.
And that is, the Extra Help program helps to pay for your prescription drug plan. And so the income guidelines are a little higher for it. I'm going to look at some of these. To get a full benefit, for an individual, your income has to be less than $907 a month.
Okay.
And then for a couple, it's $1,225 a month. But you can get a partial benefit as an individual, and a partial benefit will just pay for the plan. It won't pick up like deductibles and stuff.
But even so, with the cost of medications these days, my goodness, if somebody's on, the one that usually comes to mind is heart medication.
Oh yeah. You know, like Plavix, a blood thinner, is very expensive. And there's lots of expensive meds. But for a partial benefit, the individual, the income is $1,361, and for a couple, it's $1,838.
Okay.
And so, and then there's different levels of the program, and with a partial benefit, they may it just depends on your income, and they may just pay part of the prescription drug plan for you, the monthly premium. And then on the other two, if your income's less than $1,225 for a single person, they will pay the full premium for the drug plan, and then they'll pay some of the deductible, and then the patient will pay it can be anywhere from $3 up to like $6 a prescription.
Which is certainly
yes,
doable.
Oh, definitely.
For everyone.
So.
Now, you were talking about training. So let's say someone starts the process and they decide they want to come in and sit down with you rather than call the 508-3880 number.
Right.
They decide that they want to come in and sit down. Do they need to bring any paperwork with them?
They do. One of the biggest things is we have to have like their Medicare card, driver's license, just to verify
who they.
And usually, if they have any accounts like savings accounts or that, they do ask on the application for the number and proof of that. And the things that we have to send into the state is we just have to make a copy of their Medicare number and some proof of their incomes. If they've gotten a Medicare statement that says, I received this much a month or maybe even a bank statement that shows their monthly deposit at the top. We can use that.
So bank statement, all right. So they bring that, and then you'll sit down with the folks and go over everything, whatever it is that they're interested in, either one of these two programs or maybe even other questions about Medicare that they have. So.
And we can sit down, and it takes about 30 minutes or so.
Okay.
And we go, we do it on the internet now.
Oh,
so
my goodness.
So it's just done online right away.
Does it just file right then and there too?
It does. It'll say it's been submitted today. It usually takes 4 to 6 weeks for them to find out, and then say if we applied today in December, it would become effective in January.
In January.
Yeah, the following month it becomes effective. And a lot of people don't realize, but if they get on the extra help plan and they're getting a free prescription drug plan, that is one of the things where you can change at any time of the year.
Oh, all right.
If you're on a drug plan, you're not happy with it, and you're getting a free prescription drug plan, you can change any time. Where everyone else just has that
once a year time. So we need to take a break.
Okay.
We'll be right back. Don't go away. We've got lots more questions for Nancy about Medicare and what they're offering at the Mruk Family Center on Aging. We'll be right back.